I'm just trying to tell them that wherever you go, you talk to your friends. Because when I went to US first, in Bangladesh, we were told, don't look at someone, don't smile at someone. Even if I smile at women, I'll be in trouble. If I smile at a man, I don't know what's happening now. But when you grow up, you cannot even smile at a guy. Why are you smiling at me? What's wrong with me? In the United States, it's completely different. They'll smile at you, hi, how are you? So I said, why are you smiling at me? I'm not sure that my zipper is... And then I realized it. And after you don't smile back, they'll not talk to you. They think that your culture is not like this, so they'll forget you. So you have to understand the culture of anywhere you go and respect that. But most important is networking. I had a friend, I was walking with him initially, and he said, hi, good morning, how are you? You have a nice dress. I said, I don't want to walk with you, because I'll be in trouble. But I found he knew everything, where they're selling a old car, but which store is giving discount, because he's chatting with everyone. And it was like a gatha. I was not talking to anyone. And it took a long time to learn. When all these MBBS doctors come to United States, many of them come to me for 1 month rotations to get a certificate and experience. And they're like smiling, they're asking any questions, they would nod their head. I said, you have to talk. Their dad called me. I said, if dad calls you, you are disqualified. You know how to talk, you know how to connect with the phone. So culture is different. You came from different part of the world, but most important thing is that networking is important. So during COVID, when this thing started, it was a scary thing, and we have to go forward during the crisis. My daughter, she's a student professor of critical care and pulmonary University of Pennsylvania. So unfortunately for her, she got infected with so she's now in Syria. She's a medical director of Med Global, an NGO. She comes to Bangladesh every year for the last 6 years and training ICU to all these ICU doctors and go to Rohingya, and there's a hospital they're creating there. So she went to Yemen, and when she went to Yemen during the war, one day she was wearing the bulletproof vest, and one day the team was taken to this direction and the other direction. So I said, oh my God, I just make Frankenstein of her. And she's now Turkey and then Syria and many parts of the world. Whenever there's a disaster, she goes there. So these things happen because when you talk to your children, your junior colleagues, you have to inspire them to do something right, because life is too short. Ziauddin Ahmed, the founder of this whole Brac, before he died, he said, I did not waste my time. He created the largest NGO in the whole world. Not only NGO, I don't know whether you probably don't know him, but he will listen. I tell him anything, any ideas, he will listen to you, and then he'll give the most nice and advice is the best advice. I'm starting a kidney hospital in Sylhet. So I wanted to give you free dialysis to all of them, because dialysis, if we don't do that, then patient will die. Nobody will die with heart disease or cancer or pulmonary right away. But if you don't give dialysis, they're sure going to die in a week. So people sell their houses, their asset. So most of the Western countries, it's free. Bangladesh, 90% they die because of they cannot afford dialysis. Anyway, so our story was Ziauddin Ahmed. I'm going to start a kidney hospital. For 30 years I was at another university, Brac University in Philadelphia, the professor emeritus. And in addition to be a clinician, I get involved with many other things, including to come every year to Bangladesh and try to help the health systems, medical education, nursing, whatever we can get hold of. So today, you are most lucky group Why? Because this is an amazing institution. And public health is a very important field. We found out during COVID, right? Because COVID, we didn't have any treatment. Until today, there is no effective treatment. But what we had, we had to find out how we save people. I was in Philadelphia when it started, and my friends in New York, one of the guy, he was emergency medicine doctor in downstate. So he called me and said he went to the next day and found that dead people are lying in the floor of the emergency room. Never happened. They had a mass grave there. Next few months, people are dying like flies mostly in New York for different reasons. So what's happened? We didn't know what to do. In my Philadelphia, I remember my colleagues, we had like 15 professors in our institution. Everybody got so scared. 5 of them stopped coming because nobody knows how people are dying. I was one of the director of the kidney dialysis unit. The dialysis patient comes 3 times a week to get the dialysis and go back to their home. The one day, my colleague is supposed to go, she didn't go. She didn't come out of the house. So the nurses thought we abandoned them. They almost wanted to quit. So when I heard it, so I was going every day, not knowing what would happen to any of us. And we're sitting there just to give them comfort that the doctors are with you, they didn't abandon you. So it was a scary time. But the most important thing is that this actually something connecting the dot. This is your age to get experience. Why? Because my background is I was actually a freedom fighter. I fought Bangladesh war. My father was a shaheed. He was killed by Pakistani army inside the hospital in 1971. He was head of the department. Everybody left the town. But he said, I cannot abandon my wounded patients. Even though some wounded Pakistani soldiers were there in the hospital too. That was a bad time. So I went to the war. I was a medical student. I fought along with the Bangladesh army. So that helped me to get experience with this uncertain time and courage. When the first bullet crossed me and I didn't die, I thought, I have things to do. My life is extended. So after that, and my mother was the principal of a women's college in Sylhet. She started many years ago, 1950, with 5 students. And then she handed over to the government after it is more than 1,012 become land and they're one of the best schools. So the family, the parents actually, it's very important to get inspirations or get values. I remember many other stories, but bottom line is that after that, I felt any problem anywhere, I have to go. Anything happened in the United States when I was there, or in Bangladesh before I went, in Dhaka Medical College, I was always there, without knowing that's what's going to happen. Why it's important for me? Because now I find that any issue that developed, Donald Trump issue or any other issue, that nothing bothered me because I know we have to do what is best for us. I come to Bangladesh every year for the last 20 years and trying to set up many things, including infection control center, which is non-existent. I'm a nephrologist, but still, I'm trying to establish emergency medicine specialty, which is not existent in Bangladesh. And luckily, last year we could establish a 1-year infection emergency medicine fellowship program with University of Pennsylvania. And the first time ever, an Ivy League school did a program with Dhaka Medical College, we give a certificate program. Budget minister, and he kept all the civil service in the top and the professionals, physicians, engineer under them. So we protested just to be a parallel thing. So the whole thing, the first time, the physician, the engineering, and the agriculturists were together, the professional group called ProPG, Precautionary Krishi Vidya Chikitsa. And I happened to be the secretary of the physicians. But the engineers didn't want to include agriculture because they were in the second grade at that time. I said, we have to include them actually what? And we included. But guess what? After the movement, they were given first grade. And today, the Bangladesh Agriculture University and the graduates are doing amazing work. So even though you are young, you get involved. You go there and fight for these things. And in the future, you'll find this will be the strength, connections, and 7 United States. So when I went to I became a faculty. I was telling Sabina, the two foreign-looking person, me and there's another guy from Philippines. So guess what? Nobody looking at me. This guy came from a jungle or something. But the reason I was taken for different reason, but I had to do something more because I'm a minority. So I had to do 5 specialties. Normally you do medicine and you kidney. I had to do critical care, I had to do geriatrics, I had to do as many specialties as I could to get respect. Then I became, at that time they started giving me assignment. I became the chairman of the quality assurance. You should know this, when I went there in 1980, there is no quality assurance in the health system in the United States. You can do anything you want, unless you are caught and get sued, the physician or medical department is not watching you. So what's happened, the Congress passed a bill that you can discuss your morbidity mortality, which means that if anything bad happened or somebody died, you can talk among your colleagues and say, this was a mistake of a person or a nurse or a pharmacist or the system. And then you can fix it. So don't blame anyone, don't fire anyone, and that gave a lot of people discussing about the morbidity, and I was made chairman of that. Why? Because they found that this guy, even though he came from Bangladesh, he will spend time, extra time, he will work hard, he will do things like, and only way to go top and get respect is, I tell my students like Bangladesh, whoever goes, Pakistani, Indian, they all go there. I said, look, you come early and go late. And you show them that you are doing it. Because when I was doing my internship, I was working hard, but guess what? Nobody knows I'm working hard because I wasn't showing it. I was doing, then I realized it, even though if you're working hard and doing something extra, someone should know it. She has to tell me that Dr. Ahmed is doing a great job, then they will know. Or someone has to tell you, because you cannot brag, I have 5 board. If I tell them that, they think that I'm bragging. But somebody has to know that this guy has extra qualifications and extra work. So either you somehow find out gently to tell that your achievements, otherwise we're not God, we cannot read your everything. So make sure you do, not lying, you do the right thing, you do extra work, and you make sure that people trust you. I tell all the students and the junior doctors that if you finish your work, not only stay late, you help your friend. So these are the, anyway, kind of, I don't want to waste my time on talking some life experience, which is another story. But the COVID thing, so what's happened, we found that in the United States, it was also very difficult. Junior doctors were not coming for a few months. But in Bangladesh, we have this dialysis center. And I found out that there's only one hospital is open for COVID, and medical college, Usmani Medical College, and all of the private hospital, they all closed down. They're transporting patient to one hospital to the other, and the door was closed, and they're dying inside the car. But before that, I prepared myself that we have to do something, but I didn't have any hospital yet. We had a dialysis center. So we actually bought oxygen concentrator just before that for many reasons. And then we started 2 COVID hospitals. I called them up and I said, we need
government has two health center, which was completely, the bed is there, but there is nothing was there. So they said, go ahead. So we actually hired 45 healthcare workers, gave oxygen to each and every bed, and started accepting patient. Now, why I would do that? What's happened? I was calling everyone, networking everything, and then there is a guy. He's the army. He's not a physician. He's a brigadier of a RAB, and he said, "Ziauddin, I have created a isolation center." And he heard about this oxygen concentrator. He said, "There's oxygen concentrator, and the oxygen comes out, and I have 20, and I have 350 bed." I said, "Are you crazy? You are calling patient to this 350 bed, and you have a 20 concentrator?" He said, "That ain't okay." That's what I mean. He said, "I put oxygen and measured their pulse ox, and after 2 hours, they're okay. Then I give it to someone. I said, "It's crazy. They've never heard about it." He said, "It's working." So I asked him to do it again, check it out, and actually he did. And I found out that it's true. 2,000 patients he had given oxygen, only 2 went to CMH. Then it struck me that why these things happening. So when people get short of breath, we call cytokine surge. And then the cytokine surge will clamp your circulation vessel to your lungs, and patient develop hypoxia, which means low oxygen. And that will create a vicious cycle. We give remdesivir, a lot of things later on, but this vicious cycle only can be stopped by giving oxygen. It's a therapy. So he put oxygen and he stopped the cytokine surge without knowing. He's not a doctor. He just gave me his experience. And that's the reason I said, let's start a hospital. Otherwise, I shouldn't have any courage to do this crazy thing. So an army guy who's doing it without knowing anything, you can gather information from his experience, and we successfully run. And now I have to publish it because I don't think anybody knows it, that during the cytokine surge, you have to give oxygen. What's happened in New York? Why people died in New York? Because they said, you only call 911 when you feel short of breath. But in COVID, it's not like asthma or pneumonia. The lungs is okay. So you can, carbon dioxide retain, you get short of breath. You're not retaining carbon dioxide. What's happened? The circulation is clamped. So people has a pulse ox 80, which is death threat, and they don't feel short of breath. So they didn't call 911. So when 911 came, took the pulse ox, it's 80 and patient is talking, and then dropped dead within 1 minute. So many people died because the hospital was full. So they said, only come, you're short of breath. So the question we learned that don't worry about the shortness of breath. If somebody has a cough and fever and feeling lousy, you check your pulse ox. And pulse ox is low, you give oxygen. Hopefully COVID will not come back because of the vaccine. But things we learn in a simple way, and this is public health, and we have to spell it out that what can you do with a simple measure. Another thing happened. My brother-in-law has a garment industry, 15,000 worker. And I called him and I said, how many of your your worker developed COVID? He said, none. I said, Pablo, make sure you give me the right information. So he did what he did. Every employee worker, before they went to the factory, they has to do fever check and coughers, this and that, and only 8 people they send home, and they come back within a few days. And whole 2 years, none of them got COVID. So I was thinking, why? One is they're young, and the second is whether maybe there is no COVID there. But somebody did a study, they found that 10% of these people in that area have a COVID antibody. So they had actually COVID infection. But why they didn't develop serious COVID. So then I realized they have an industrial vent in every cotton garment industry. So even though they're sitting 3 feet away, this vent is actually driving this COVID out. Maybe he's inhaling minimum dose that only acting as a vaccine dose, but not as in. So ventilation became a very important thing. In United States, every school they had to recreate such a way that there's a vacuum, there's a high industrial ventilation. In our hospital, we had to make most of the room negative pressure ventilation. So there's a lot of things you learn from observation, and you use it. You use it for your clinical application. So in public health, the clinicians and the public health people, all this we found out they're so important that they work together. So I talked about in Sylhet that we made the COVID hospital and it worked. So I don't know how long I talked already, but I want to stop here and make sure that if you have any questions on anything about what I just said. You have a question? Thank you, Mr. Bhai. You know Dr. Mushtaq, right?
Yeah. Do you know when the school was set up?
And
He's
Mrs.
the founder
Rabi.
dean, and I was the 4th employee. August 2004. Mushtaq bhai, ye bosh. Can we welcome? Please continue. Sorry.
I'll prefer you to ask me any question. I'll just give you some overview, what I do in the United States. And so now the public health is not only health. There's mental health, there's a social health, so you have to get involved with everything. So Mushtaq Bhai knows we got involved with cultural, agricultural, and everything else that make your overall health, like as WHO definition of the health, you need to do that. And as a public health leader, I think you can do it very easily because you'll be empowered with all the informations and leadership skill, and you can connect the different group. Like many clinicians will only listen because they're so busy, but you can connect them, the cultural group, the social leaderships, activism. So everything is needed not in Bangladesh, also in the United States, in the developed world. We have to do activism. We have to be actually the leader and the partner of the patient care.
Do you want me to open it up some?
Yeah, please.
So first of all, thank you so much. Can we share a round of applause? I think from a personal perspective, I was quite moved up there. You're a freedom fighter. You could be young. Abba basically gave his life to do his work, which I found very emotional. The fact that you keep coming back and you want to give back, I think it's really amazing because a lot of people leave and they have no connection. And I thought it was very interesting after COVID, you're sharing about COVID and also the experiences you saw, and then even in Bangladesh with the garment factories, I never actually thought about the events. And I think it's an important time. Here's our chance to really ask any question we want. And I know you're a smart group, you have lots of questions, and we start with you. Yeah, can you just say which country you're from and your name? Oh, sorry. Yeah.
Before I forget, see, there's so many opportunity of doing research in this country. Bangladesh is like a wide open ground for fertile research. So Dr. Mushtaq is world-renowned researcher, and he's Professor Emeritus and the ex-dean, and he'll be always available. And Sabine, I'm impressed with her energy and how she's She's keeping everyone on toes. I think
Someone's got
you
to
are
do the hard
very,
job.
very lucky. You have to take the advantage of it, because many places you may not have the leader like this. And I think it's a great opportunity. And one thing is very important: if you publish good research, you'll go somewhere. You will just progress very rapidly. People will trust you. People will respect you, and in your field, you can. It's very important that you do research, especially from this school, which is a famous school. Thank you.
Thank you. Thank you. So what I would say is raise your hand, or I'll ask you, and say your name. Thank you. And country, huh?
Good afternoon, everyone, and namaste. It is Ms. Saraswati Giri from Nepal. I have a few concerns about the COVID, because we also faced the many problems during the COVID, and especially for the second phase during the Delta variant time. You are saying that that one organization, the youngsters are not affected. Just give one example. In context of Nepal, in the second phase, there are so many youngsters are died, and there is a one major issue is the lack of oxygen availability. Is one of the major issue, because there is no preparedness plan, no response plan before that. But after the Delta variant, we developed the one response plan, and but in the beginning there was no. But many youngsters died in second variant. For the first time, most of they are affected old age in first phase, and but second phase mostly the youngsters died. What about the Bangladesh? I just want to concern about it. And another is the remdesivir medicine. It was very a kind of viral in Nepal, because if we give remdesivir, the patient will be survived. That's why the people are ready to buy the medicine, even from they are taking from the India as well, and they are paying high money, or around one vial, around 70 or 80,000. It's mostly happening in the Nepal. What about the Bangladesh? I just want to know about it. And about the COVID response plan and the strategy, what about the Bangladesh? They already prepared this.
Bangladesh or US, you could even share.
Yeah, I just already.
This is very important.
Can I take a couple of questions?
Sure.
Okay. Thanks. Anyone else? Oh, here. We start with cut. Every example is cut from Yemen. I won't ask questions. Let's take 3 questions and come back.
First of all, Assalamu alaikum in Yemen country. My question is, we have a lot of vaccines, a lot of companies. My question is, because maybe I have little information about the vaccines. So do you think that all the vaccines that are producing right now in the worldwide, all of them are good with effectiveness, or do you think that some vaccines are better than others? And I have just one comment that when the UN or the UNICEF provided the vaccines for Yemen, especially in the first wave, we faced a lot of obstructions how to convince people to get vaccinated, because they say that there's something wrong with the vaccines, like that. And that day, I remember that I took all my family in 2 vehicles and I forced them to take vaccine, and then I will convince you. So, but this is my question.
Okay. Thank you. Maybe you respond to the 2.
Yeah,
and
2.
then we go to the other 2.
Yeah, because I'll forget.
Can you be patient?
So,
okay.
Saraswati. So her question is that why people didn't die, the young people didn't die for the first phase, and why die in the second phase, right? So what's happened? The first one was very serious. Why second phase died slowly? Now people are getting vaccinated, so most people are not dying if they're getting the right vaccine, which I'll come back to you. So what's happened? I have to find out exactly how many young people died, because some of them may have comorbid conditions. Immunity is suppressed for a different reason. So the question is, when the COVID hits, your own immunity is important. So that's why so many young people died. Maybe 5 people died, but we don't know exactly what percent. If really many young people died, then we should do investigation of what's happened to them. So this is something educational. You have to know why these people died with the second or third phase, when the virulent infectiousness was more, but the virulent was less, even Omicron. So that's something interesting to know. Bangladesh, the preparedness, 0. Why 0? Because when first thing, not too many people died. And so people dying, most people died where? In Dhaka, or places where there's a closed apartments. Why? There is no ventilation. So if somebody coughs virus in the first floor, it circulates to the central air condition. They're older people. There's nothing happening in the village. So why not in the village? People refused. People thought, we never had COVID in the village. So I know this guy, General Brigadier, he's interested in COVID, this guy. So when he goes to the village, he asks people, do you have anybody admitted with a fever or cough? No. And he couldn't find, even in the slum area, that people said, I'm suffering from cough or shortness of breath. Whereas we know that in the main town, when there is this apartment building, the older people or even the young people, they got COVID and they died. So ventilation was important. And I think...
So it's a case of reverse equity.
Right.
Yes.
So this is important. We found out, and also the statistics showed that 80% of COVID happened in the closed area in New York, in the bus, in the house, and in all the offices. So we know that the ventilation is important. That's why in the New York, all primary school has a new ventilation system. So they have to go to the school, so they want to make. So people are changing. The ventilation is very important. Preparedness for the COVID is, again, get vaccine. And whenever somebody is coughing or there is a high risk people, they have to wear a mask, self-distance. These are still important for any other viral infection that's contagious to the airborne. And if you do that, then I think there will be less virulence and death. Vaccine, see, Chinese people are still dying because they're using their own vaccine. But this RNA vaccine seems like they're more effective.
Which one?
The Moderna and the Pfizer, both of them are more effective than...
You can mix it, is it? I'm sorry, I'm asking because
You can mix
an
it.
expired one. Recently it said expires November, and then they said no, government has checked with manufacturers, it'll work till Feb. I'm thinking between government and manufacturers, there goes my arm. But I wanted to ask you, and it's mixed. I've done AstraZeneca, I've done Moderna, and now expired Pfizer. So where does that leave me?
So the expression...
I'm okay.
Republican physician, I can say that
I'm okay.
we are giving patients also like who are with Pfizer, they can come.
And expired?
Expired, I didn't get the experience with that, but I don't think when the date with the expired is always, you can say, right?
Yeah.
It's always few years after that, so don't worry about that part.
Thank you.
So-
For the
See,
medicine.
that's why we have these guests, just to make me feel reassured.
So the expiration date, which is another issue that I like to talk about. Expiration date is given by the company.
Yeah.
In '93, United States government said, put expiration date. So they said, what does it mean? It means that the company is not giving any guarantee of the effectiveness, not that it become poison, after 2000 whatever. So they put a date. So good for the company, so you can throw it away and buy a new medications. But the expiration date is never meant that this particular medicine will be poisoned next day. We have a tendency, oh my God, it expired last week, throw it away. So what's happened during the first Iraq war, the army of United States found that they have $3 billion of expired medications. So before they throw it away, they decided to check it out. So they spent maybe $30 million and found that the 100 medicine, the batch, actually, even though it's expired 15 years ago, the 80% efficiency is still there, unless they're
How
injections.
many years ago?
Huh?
15 years.
15 years.
They stopped
sorry.
going further.
I think he's asking which is the best vaccine. No? Which is the best vaccine out of all?
So that's expiration stuff is different. I wrote these things because my friend has a pharmacy in Bogota. He does charity work. And this magistrate went there and found expired medicine, and they kicked his pharmacy and everything. So I was so mad. So I wrote cited that reference of US government's published data from CDC. Nobody reads it because public scared, and the company, they want to hide it under the rug. And Portomalo didn't publish it.
Didn't.
No. So I told Muttur Rahman, then Apnara, why you do this thing? Oh, next time please send it to me. Anyway, the point is, this is a sensitive issue, that expiration date. But expiration date 6 months, 1 year. When I go to United States, I take a lot of antibiotic with me. Why? Because some guy who has no insurance, or I give them antibiotic, and I take sometimes 3 years expired antibiotic, and I get better. So, answer to your question, that so far the information said that Moderna and Pfizer RNA-based vaccines are more effective than the others. And the others has also 70%, maybe 60%, but the Moderna and Pfizer is so far. AstraZeneca is...
Isn't this a political war between Europe and America?
No, always there is some politics too. But sometimes they will do some small study and publish it that this is 99%, and then another study shows it 80%. But overall, because of the way it created, AstraZeneca is like the old way with the vectors, but this was RNA based, so it's supposed to be, and it's actually effective because in the United States, people are not dying like before. Any other question?
So you two have hands up. Thank you. You cleared up a lot.
Thank you so much for explaining. I was curious to know about that. There was a study published in JAMA which highlighted about the heart attack among the youngsters, especially after the vaccination. So, do you think that is there any link or association?
Sure. So the vaccine denials, like you mentioned, you are worried about, when you mentioned that your family or somebody was refusing. So in the United States, there's a big group of vaccine denier. And you can see YouTube, they're saying vaccine is bad, don't take the vaccine. They'll create a monster of you because they're manhandling your DNAs and RNAs. So we don't know. I don't think it's true because people are not dying like before. And there is this RNA is not like the changing anything. And before that, there was some misinformation about how it created from the fetus tissue and this and that, just created anti-religious Christians and Muslims being very upset. We don't want to take a vaccine because it has a human this and that. These are not true. Yeah. So some serious Christian group and serious Muslim group, they were not taking it. But when people who refused, big preachers, when they died of COVID in United States, and people realized it, but still there are many groups who is denying vaccines. But we know that only way to prevent COVID or save COVID is giving vaccine, because we don't have any treatment yet. Remdesivir doesn't work. Even though we've spent so much money, there is one study showed it worked, next study shows it didn't work. So still give it because there's nothing else to give. What works is a steroid works and some of that.
I think his question, which has come up a lot,
Yeah.
young people.
I'm coming back to
Yeah.
that. So next thing is that his question is that post-COVID, like here we had COVID, after 3 months, 6 months, he died of heart attack. Nobody knew there is a connection. They thought, well, he died of heart attack, he didn't die of shortness of breath, so it must be different. But we found that now, a lot of post-COVID, all organs, they did a study in NIH, they published it, that 45 people died 1 year after they become better of COVID. They had COVID, they got fine. 1 year later, they died. Just died from other cause, regular cause. They did autopsy, at least 50 specimens from different part of the organ, and guess what they found? They found live virus in all part of the organ, even though the patient died 1 year ago. And then we found that why patient gets short of breath in COVID? Not because of the pulmonary disease. They can breathe, they can, but their vessels become involved. Somehow it become narrowed. And that's why the damage happened to the heart and brain, because many people are forgetful. They are getting dementia. So if every organ, say brain, if you get dementia, the kidney people, we think now the kidney function suddenly, they are a little worse, suddenly deteriorated faster. So basically the COVID virus is destroying your endothelium of the lining of your small vessels. And that's why even though they're young people, you can die of heart disease because it's the acceleration of your aging process, you can say that way. Now, vaccination is important, but vaccination does not prevent you from getting COVID. A lot of people are getting vaccine and they are getting COVID. What vaccination ensured that you don't have severe COVID? You can get COVID, but it's not serious, or you don't get in the ICU, or you don't die. So that's why the best thing is not to get COVID. Even though you are vaccinated, do not get close to someone who's coughing or somebody has a COVID. So there is a chance of getting COVID, but yes, you're going to die. But they found that people even didn't come to the hospital. They had a post-COVID syndrome, long COVID we call. So unfortunately, we don't have anything yet to get the COVID out of our system by any medication that kill all the virus yet. Hopefully in future, we can find something, but prevention is most important.
One more question back there. Any other questions we can take quickly? Yes, from Afghanistan we have. So from you, Afghanistan, and whose hands are up? Oh my God, oh my God, oh my God. And then you three. How about we take the two and then you three and then we have to wrap up?
Yeah, sure.
Otherwise he's going to start complaining. Dr. Ziauddin Ahmed, we brought him here and then...
No, he'll be happy.
Are they fine? Okay.
I have some online students. I don't have any questions, but you can ask them.
There is a hand up for an online question.
Yes. So
already. So I think we take one here and then online, and then we wait for the other three. No, why can't go on like this?
I'll give a short answer.
Yeah. Maybe. You want to ask?
I have two questions. Number one, that you said that when you give oxygen for even a short period of time for the cytokine rush, the cytokine stress, then it can recover the patient easily. So that means we don't need to give, because in the hospitals we have seen that we were giving high flow oxygen continuously and still there were patients who were not recovering. So I mean, these are like very conflicting. And the other one is, I think it's almost you have answered it, but my question is, I have been seeing people who are close to me, like my parents and my grandparents, and people who I monitor their health. So it's been very difficult to keep the blood sugar in check, because no matter how many drugs are being introduced, but their blood sugar is not in the normal range as much as it used to be before COVID. So is this the effect of COVID or COVID vaccine, or like, I would like to know that.
So answer to your first question is, you have to treat them early. if there is a cytokine surge continues and you have hypoxia for longer time, then the damage is already done, and cytokine surge cannot reverse. Oxygen cannot reverse the damage which is already happened. So that's why if you see the pulse ox is less than 93, just give oxygen. When it's too low, then probably patient will need high oxygen therapy. And second is, yes, diabetes also get worse after COVID. There's a study done shows that diabetes get worse after the COVID. So every organ can get damaged by the COVID.
Mokhtar, do you have a question?
Yes, sir. Hello, good afternoon for everyone, and most welcome, sir. My question is that as we all know that health systems are different between a developed country and between advanced countries. My question is, which systems are more effective during the COVID-19? I mean, most effective during the COVID-19. As we see that almost too many deaths are happening in most developed countries like United States. What do you think? What do you think? What's their weakness point? Is there any weakness point in their public health system or anything else that too many deaths happened in their countries?
It's a very good question.
May I just get the three
Thank you.
questions? 3 hands up. Can we get those questions? We'll have to limit it to 3 because I'd really also like to invite Dr. Fatima Bhabi to say a few words. She's also a public health expert in her own right.
Good afternoon, everyone. I have 2 questions. One, my first question has already been asked by Mokhtar. I'm also thinking to ask this question to you. As we have seen that in America, there is millions of people suffered and died. But in context of Bangladesh, as it is a densely populated country and our health system is not so developed like the developed countries. So what's the main reason behind this? We didn't see the huge amount of death in here. And my second question is post-COVID psychosis. In my family, those who have got attacked by COVID, they always complain that they have some psychotic problem. They always feel fear of being dead. And what is the reason of behind this? I'm asking.
Good questions.
And the last 2 questions.
So my question is, we know that who are public health professionals, prevention is better than cure. So my question is, does Bangladesh government or any other organization, they also maybe know that? So why they do not apply the ventilation system in the government hospital or any other health facility center? Because it's very important during the COVID period.
Thank you. Any other question?
During COVID time, I observed that some people's pregnant women and some practice of the doctors, there is I observed some people advise during pregnancy they should take the vaccine, but some people thinking during pregnancy we should avoid the vaccine. So I want to know about this thing, pregnancy and vaccine effect. And another point, after COVID, some people say that they're facing difficulty with remembering thing or memorizing thing. So how can they deal with it? And is there is any connection between COVID and memory?
Thank you. These are very good questions, real practical questions. So let's start with
one more question in the form as well.
Let's do these 4. Okay, is it a quick question? Chipo.
Good afternoon and thank you very much. I just wanted to ask a question that, because I had a brother, he contracted COVID and he was in ICU for almost 3 months in South Africa. But eventually one doctor, well, we thought we were going to lose him. And then one doctor came in and he did a bronchoscopy on him. So after the bronchoscopy, that's when things changed. And he was out of ICU in about 2 weeks. And yeah, up to now, he's doing quite well. So I just want to understand should I say the physiology there, because you spoke about the cytokine crisis that takes place, and we're saying that these are blood vessels that get a bit constricted, and that's affecting the blood supply to the organs and all that. But then the effect of the bronchoscopy now, because I understand he had quite a lot of mucus that was removed after the bronchoscopy was done.
Super, it's a very good question. So let's start with which one I forgot.
The first one was from
the United States Service. Okay, so this was a sudden attack by COVID. Nobody was prepared. Nobody knew what to do, and there is no treatment. So what's happened? That's why especially in the closed area at that time, people are living in New York in a closed area, and most places, especially in the big cities, they were dying because they're contracting COVID. And there's no treatment. And they were told, don't come to the hospital unless you're short of breath. But COVID, since it's a vascular disease, the lung is breathing. So they're not getting short of breath. In asthma, heart failure, why you're short of breath? Because you're not getting oxygen. I mean, your CO2 is retained. Here, CO2 is you're breathing CO2 out, so you don't get short of breath. But if you do pulse ox, it's so low. It's like I just told you before that it was 80. So when people came, many of my friends, family member died. They called last moment, I'm short of breath, and the 911 came and checked the pulse ox, is 80. And before he was walking and before he ride the ambulance, he just dropped dead. So people didn't come to the hospital to get oxygen. Why? Because hospital was full. And they said, do not come until you're short of breath. So nobody knew. But what's happened in the United States, the CDC and everybody, the public health, like smart people like you guys, they found it out soon, that what are the things happening. And that's why the isolation, that's why the giving oxygen, we had in Philadelphia, our gymnasium, we opened with many beds because our hospitals are filled with patients. So people are expanding. There was a ship which had oxygen in the bed. So people are opening up beds so patient could come and stay in the treatment. And there is no treatment except the giving oxygen, keeping them alive. So let's go back to that Chipo's question. She's a good question that her brother had a bronchoscopy means that there's a tube that under they put it on the bronchoscope and they remove all this junk, the cough and everything. So bronchoscopy is it's a clinical thing. Her brother was sick because of the COVID. In addition, he was having so much mucus that could be from anywhere. Pneumonia, you have mucus, you have asthma, you have mucus, after surgery mucus. And these are the normal procedure in ICU to make sure the lungs is clean. So his doctor realized that he has a junk in his lungs. It's not COVID junk. I mean, COVID is making the basic issue. So he removed the junk. So many people actually die, not from COVID, from any other thing, if they have a lot of cough, not coughing out because they are too sick. So you have to do bronchoscopy. It is a indicated procedures when there's a lot of cough in the bronchus. So he was actually sick from the COVID, Chipo's brother, but he was not recovering because nobody was sucking his cough out. So they just did that and they did a good job. You can do it from the tube and then you can go down to the bronchus and do it. So that's why because it is not a mucus plugging, because everybody gets bronchoscopy. So they were so this is the part of the comorbidity. When you get sick, different organ fails, different organ does different things. So it is not that COVID kill you. Why people survive? Because when you can keep them alive, not dying from kidneys or heart or from lungs, then slowly they will improve. Your question is?
Pregnancy vaccine.
So pregnancy, it's already known now. See, in India, you might remember, there's many pregnant women who are dying with children with COVID, right and left, and nobody knew why. Then they found out that actually the death rate was so high, only the same young group with pregnancy. So after that, we don't know still, we think because of the same issue that the compromise in vascular support and the inflammation, it's a intense inflammation happened. So they start giving, first thing, any vaccine that you give, they will say, do not give children after below 5, do not give pregnancy, do not give 8 years old. So these are the normal precaution until you prove that it's not harmful to them. So when they studied COVID vaccine to the women, pregnant women, they found that they are actually doing much better than the women who didn't get the vaccine. So it is now known that anybody who is pregnant, they are safer to get COVID vaccine. It is already established. So that's one issue. Any other? I forgot what's
Any other questions or not answered?
Psychosis and forgetfulness and memory, these are the similar thing because the brain is unfortunately get involved. And I have a friend, senior friend, he called me, he's a physician. He said, I forget everything. I can't remember the name of my colleague. So people are forgetting things. People are getting psychotic, like they're seeing things. And these are all neurological phenomenon from the COVID.
2 months. Not going.
After COVID.
So the cough.
I forget. I forget a lot lately, and I wonder if it is.
Did you have COVID?
Yeah.
Okay. So forgetfulness is something not uncommon.
Yeah.
Are you getting better? Your memory is getting better from before?
No, I mean it's not that I've lost my memory.
No,
but I feel like I forget more than I used to.
That's what I'm asking.
Yeah.
Do you feel that you're getting a little better from before? Like when we started forgetting things, are you feeling that your memory part
is
is
coming back or not?
A little better?
It's okay. I just find it frustrating. I wouldn't say it's improving.
No.
I would just say I have more moments of forgetfulness than I used to.
So basically
not major, but just interesting.
It seems like you're adjusting yourself, your life. I think you're adjusting yourself with your
I mean,
forgetfulness.
it could be I was always forgetful, but I'm just saying, when you start hearing these things, you just don't know whether it is a reaction, is there, because I know people who are talking about forgetfulness, about trauma, about fears, and you don't know if it's heightened through the experience or people generally, those of a nervous temperament,
these are all right. You know, you might be noticing it more because you know now that this can happen.
Yeah, so I don't know if it's one or the other.
Those are the two factors.
I forgot all about your grades.
Yeah,
How about
I feel
that?
So
That's okay.
it's an organic thing. It's not really a psychological
I'm
thing.
also feeling like I have got 2 times infected in 1 year.
It's okay. You graduated.
So this is
Your assignment is still due, huh?
So this is an organic phenomenon. This is not a psychological thing.
Yeah.
Anybody who gets psychosis or forgetfulness or nervousness. So there is a book actually published by one of the Bangladeshi psychiatrists from the United States. So she had a wonderfully written how to adjust it. So first thing, your family member should know that this person is a COVID. Whatever this craziness she's doing is actually it's an illness. This person is not doing it to annoy other people. So when the family knows how to adjust it, that's a big support. So this is from the COVID. And it might get better. Slowly it gets better, but sometimes it stays for a long period of time. This brain thing. Cough, fatigue, shortness of breath. 40% of the people still has cough for after 1 year of COVID.
Wow.
And so this
Only
is
2 months, one for me.
1 year.
Yeah, 10 months to
Mommy, be
go.
prepared.
there must to go.
10 more months.
No, you don't have to have, you might get better soon, but I'm saying that the study showed sometimes it lasts longer. And as I told you before, that virus is still in us, not in us, because of the study shows that it stays. So we have to make sure that you're not immunosuppressed. Make sure you do all this good stuff that immunosuppressed. So and then the inflammation. There is some, I'm trying, I was involved in the research of giving something called superoxide dismutase. It's anti-inflammatory things. And anecdotally, I gave to some people. And one of the person, she was not even moving her legs. She started walking in 3 days. I was so impressed. I was sending randomly to at least 40 people and trying to get their fatigue score. And guess what? It's Bangladeshi people are really so callous. Oh, I forgot. 2 days I didn't take it. Oh, I don't know. I didn't like the taste, like a mango. So now, but I think this was called Revivify. It's a super. Actually, I brought someone trying to start a study on not COVID, because the post-surgery fatigue after the bypass surgery, it takes 2 weeks to get better. So anyway, so we're going to find out the fatigue and other inflammation, because COVID caused severe inflammation that medications or food supplements are not. But still we are working on this. But anything is important for you guys, the public health group. Whenever you listen to someone, try to think. Don't think that we don't know this, or doctor said this, so you accept it. We don't know yet. Not world expert knows everything yet.
We're being experimented on.
So right. So you have to, observation is very important. Wherever you go, wherever you observe, write it down. You might find out it's opening a gold mine or something. Because, and listen carefully. Like when I listened to my brother-in-law, who is not a physician, and then the CDC started saying that ventilation is important. But before that, I observed it and all kind of stuff. So this is an oxygen, similar thing. I talked to this brigadier. He has no clue. He is a non-physician, but his experience helped me to design 2 COVID hospitals in Sylhet. How can I start a hospital without a COVID medicine? I'll kill them. But I decided, I found out that from his experience that I can start a hospital with oxygen.
Thank you. I want to say